So if you look at the IT infrastructure of the health system, we have firewalls connecting the enterprise. No one can, the idea is no one can breach or should be able to breach the back end of that firewall to access that data. But we know all too well, more often than not, there are a number of reported breaches associated with that data. So people are taking that data and they're coming into the front door of a health system, and they're using that data to acquire services. So that's where medical identity theft comes in and payment fraud comes in. And so what we're talking about is how do you protect the front end of the business? So having a unique health safety identifier, or let me back up and say identity proofing of an individual, and matching that identity with a health safety identifier, coupled with a dual factor authentication, you can establish a process that gives you 100% confidence that the patient coming in that front door is in fact who they say they are. And not only that, you can attach that person to a specific set of medical records and have 100% confidence that the data that you're using to understand the previous history of that patient, as well as to provide treatment of that patient, gives you that confidence. So the IT organization is protecting the back end through firewalls, and our solution protects the front end, ultimately creating a 360 security ring around the healthcare system, ultimately improving the data quality. So when a patient within a health system is identity proofed and assigned a unique health safety identifier with a dual factor authentication token, doing it within one institution is great. But now I go to several clinics within that health system. The health system might have several hospitals. How do I traverse that community of care and even the extended community of care with the same identifier? So ultimately, and that's ultimately important relative to interoperability. Once I am identity proofed and assigned a unique health safety identifier, and every other system every other hospital and clinic in that health system and or surrounding community systems are on the same network, I can ultimately take that identifier with me as the patient and use that at every supporting healthcare institution. Hence, when those records are established and that my unique health safety identifier is attached to that record, when it's exchanged, it's exchanged with confidence, knowing that I have an incoming record with a unique health safety identifier attached to it. I can look in my current system and say, oh, I have another patient in my health system with that exact same identifier. So if they're all supporting the same construct of identity proofing, dual factor authentication, having that confidence that the patient is in fact who they say they are, and having a cloud-based system that operates outside of the respective EHRs to manage identity, I can then take that incoming record, look at current records, and be able to match them with confidence relative to knowing that it is that same patient. And ultimately, we don't have an interoperability problem, I would argue, in healthcare. We have a semantic interoperability problem. We don't understand the data that's coming in, and we're not able to match that data with confidence relative to who that patient is. And hence, we create duplicate records, we create overlays, and that ultimately leads to data quality issues. And that data quality issues leads to a subpar delivery of care. So unique identifier, being able to take it from system to system, it helps attach it to the medical record, and that eases the burden of how do we confidently exchange documents and know it's about the same patient. So the healthcare system is moving from encounter-based to value-based. And as I had said before, you need to take some of the legacy issues out of the system in order to get to a true value-based care model. And in order to do that, you have to look at the quality of the data. You have to get rid of duplicate records. You have to get rid of medical identity theft, and you have to get rid of payment fraud. Lenovo Health does that with their AIMe solution. But that said, it doesn't go far enough in the context of what does that do? right? I fixed 3 major problems, but what's the domino effect to that? You know, we look at it in three separate but integrated efforts. You have data security, you have you have data quality, you have system security, and you have delivery of care. We talked earlier about the idea of the firewall being on the backside of the ecosystem, right? Protecting the data that's in the data center. We talked about what Lenovo Health is doing relative to protecting the front end of the system relative to patient identity and identity proofing and things of that nature. So now we've provided that 360 security chain link around the healthcare system. And because we've addressed duplicate records, medical identity theft, and payment fraud, we've now enhanced the quality of the data. So security, now we have quality, security is done, we have quality of the data. Now the physician can deliver care with absolute confidence that the data that they have for that particular patient is in fact related to that patient, and they can eliminate a lot of the redundancies and a lot of the lack of clarity that's in the medical record, and allow them to, again, establish a diagnosis and a care delivery plan that is going to be succinct to that patient without reason for fear that they did so using poor data.